Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-552-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we can't see or hear you. If you have a question, please type that in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We'll save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you, Rachel. Good morning, everybody. I hope everybody had a wonderful Thanksgiving. If you're an OU fan, you're probably feeling really, really happy. And if you're an OSU fan, maybe not feeling so happy. If you're an Ole Miss fan, you're probably feeling very betrayed right now. If you're like me, you're probably just feeling kind of confused. So the good news is that's not what we're here to talk about today. We're going to talk about Medicare. So let's go ahead and get started. First, let me share with you that the Medicare Assistance Program is funded through grants through the Administration for Community Living, and it provides us with funding to educate Medicare beneficiaries about Medicare and what their options are related to their Medicare coverage, so that they can make the most of that coverage. We want to make sure that people are getting the coverage they need, as well as what they want in the manner that they want it. And so that they can just go on enjoying their senior years, their retirement years, and with as little hassle as possible. Now, last plug, folks, it's D-Day. It's the final week. Open enrollment ends Sunday. Now, we're not open on Saturday and Sunday, so the last day you'll be able to talk to one of our counselors is going to be Friday, the 5th. So if you need some assistance, if you want to talk to a counselor about anything related to open enrollment, Medicare Advantage plans, Part D drug plans, all that good stuff, please give us a call at 1-800-763-2828. This is a good time to review your coverage. Even if you're happy with what you had last year, you still want to take a look at it. Some people aren't aware of the fact that we don't have as many Part D drug plans as we had last year. We had 17 different plans last year. This year, we've only got 11. So we want to make sure that one, the plan that you're currently on is still going to be available, and two, it's still the best plan for you. So please give us a call so we can take a look at that. But our topic for today is going to be Medicare changes for 2026. We want to touch base on what we know about what's going to change for next year and touch base on it. Wish I could tell you that this is all that's going to change for next year. We don't know. Things tend to change rather quickly in this age and with this current administration, but I'm going to go over those things that I do know about and give you at least what we know at the moment and how we think that might impact you. So moving forward, we do know that the Social Security cost of living adjustment for 2026 is going to be a 2.8% increase. That's an average increase of about $56. That's not what everybody's going to see. That's just an average of everyone across the country. So some people it may be more, some people it may be less. but that's what that increase is going to be for everyone on their Social Security increase. Now, keep in mind, uh, your Social Security check, that's where most Americans, that's where their Part B monthly premium gets deducted from. So that Social Security increase, part of that increase will go toward the Part B uh, premium increase that we're going to talk about in just a second. Now, the Part A premium, most people don't pay anything for that. You've been paying for it. As long as you've been working and you've worked at least 10 years paying FICA taxes, you're not going to have to pay a monthly premium for Part A. For those people who have worked at least 30 quarters, those people would still be able to get Part A. They would have to pay $311 a month to get Part A. Now, Part A, as you know, that's the part that covers mainly inpatient services, but it also covers skilled nursing facilities, home health, and hospice services. However, if anyone has worked less than 30 quarters, then they would have to pay the full amount. The full amount for 2026 is going to be $565. That's a lot of money, but they would still be able to get Medicare Part A if they needed it. Now, the inpatient costs for Part A have also gone up a little bit for 2026. If a person is admitted to the hospital, the first thing that they're going to pay is the Part A deductible. That deductible is going up to $1,737. And that's going to cover them for the first 60 days per benefit period. Then starting day 61, the individual would have to pay $434 a day per benefit period, and that's going to go from day 61 through day 90. If by chance they're still inpatient during that same benefit period, starting day 91, that would go to $868 per day. Now, when you're talking about inpatient coverage, that's when we're talking about benefit periods. And for anyone who's listening who has not dealt with benefit periods before, a brief description of what a benefit period is, and this only applies to Medicare Part A, inpatient coverage, and skilled nursing facility. A benefit period begins the day that you are admitted to the hospital. A benefit period ends when you have been out of the hospital or skilled nursing facility for 60 consecutive days. It doesn't matter how long you were in the hospital. You may have been in the hospital just 2 days, or you may have been in the hospital for 3 months. What matters is that you had been discharged for 60 consecutive days. So these numbers, these costs, apply per benefit period. Now, for skilled nursing facility care, this is the care that you can receive after you've been admitted to the hospital. You have to have been admitted to the hospital for 3 consecutive days. And maybe the doctor feels like you're not ready to go home yet. You still need some additional assistance, or perhaps you're still receiving some medication or something like that, so you're not quite ready to go home. They can send you to a skilled nursing facility. The first 20 days of that care per benefit period is covered at 100%. If, however, you're still in that skilled nursing facility after day 20, then you would start paying $217 per day through day 100. After day 100, though, you would be responsible for all costs during that benefit period. Now, Part B costs, unfortunately, have also gone up for 2026. I believe this was about a 10%, maybe an 11% increase on the Part B monthly premium. Actually, I think it was a 9% because it only went up to $202.90. Originally, they were thinking it was going to go up to $206.50, but the actual amount that it was announced to go up to was $202.90. Now, for people in a higher income bracket, that amount is going to be higher, and we're going to cover that in the next slide. The annual deductible also has gone up a little bit. The deductible for 2026 is going up to $283. So in addition to the monthly premium that a person would pay at the beginning of the year, they would have to pay their deductible of $283, after which they would pay approximately 20% of the Medicare allowable fee schedule for the care they receive for Medicare covered services. Now, this is that higher income bracket information that I was talking about. For people who make more money, they are expected to pay more for their Part B monthly premiums. And you can see by this chart the amount of money that we're talking about. This only impacts approximately 5% of all Medicare beneficiaries. Most of us fall into this first line up here at the top, where it's less than or equal to $109,000 for people who file as an individual on their income tax, or less than or equal to $218,000 for people who file jointly. I just noticed I've got a typo right here. By the way, this is based on your income tax return from the 2 years prior. So for 2026, they'll be looking at your 2024 income tax return. So for those people in that first bracket, they're just going to pay the regular amount, $202.90. However, if you fall in one of these other brackets, that's the higher amounts of income, you might be paying these higher amounts on your Part B monthly premium. Now, we all know that some people may have made quite a bit more money in the year 2024. Maybe they were still working and they were drawing a much higher salary. It's always possible for someone to contact Social Security and to talk to them about the fact that their income has dramatically changed and that they need to file a revised return so that they can demonstrate that their income has dropped. You can do that. So just reach out to Social Security and find out what you need to do to get that amount reduced. Now, I will also tell you, though, based on experience, if you are someone who is in one of these higher income brackets and you just happen to have a bad year in the stock market, that's not necessarily going to be a reason to pay less for this year. It has to be something that's going to be expected to remain at a lower amount, such as maybe you were working as a physician and now you're not, and you're not expecting to be drawing that kind of salary in the future. Now, always want to remind people, the Medicare and You Handbook is a great resource. This is a document that comes out to every household. Some people have opted to get this electronically, and that's great. It's the same information. If you're one of the newer folks to Medicare and you like to get things electronically, that's great. Keep it on your computer. It's always handy. But for some of us, we'd rather have that paper copy and keep it around and be able to refer back to it and stuff. So make sure that you've got your Medicare and You Handbook for 2026. You can answer a lot of the questions that you have straight from this book. The other thing that's nice about this booklet is in the back, it's got all of the information about the plans that are available for Oklahoma in the back. So if you didn't receive one of these, let us know. We don't keep a lot of them anymore, but we may have one that we can send you if you need it. The main part of the book, it doesn't have the plan information in the back, but you can always just Google Medicare and You 2026, and you can pull up a copy of this book at any point in time, anywhere, and find this information. Next, let's talk about some of these big changes that are taking place for 2026. The first one is a few years ago, they started talking about how CMS was now going to be allowed to negotiate some prices on these very high cost medications. Some of these prescription drug meds were outrageously expensive. And it was very difficult for the plans to negotiate any kind of reasonable price for these drugs because they didn't have the negotiating power. CMS, however, because they represent all of the Medicare beneficiaries, would have that kind of negotiating leverage. So, beginning this year, we are going to be able to take advantage of that negotiating power. And we will actually have the prices for those 10 Part D drug plans that were the initial drugs that CMS negotiated. I'll show you that list here in a minute. So for 2026, we're going to have 10 Part D drugs for which CMS has negotiated that price. In 2027, there's going to be an additional 15 Part D drugs that CMS has negotiated a price for. 2028, there's going to be 15 drugs that's going to be a combination of Part B and Part D drugs. You know, some drugs are covered by Part B because they're administered in the doctor's office. Some of these may be cancer-related drugs, some kind of infusion therapy or something like that. And then in 2029, there will be an additional list of 20 drugs that again will be a combination of Part B and Part D drugs. Here's a list of the medications that are covered in 2026. And by the way, these have to be covered by all the Part D plans. That's part of what's in the Affordable Care Act. Eliquis, Jardiance, Xarelto, Januvia, Farxiga. You can just picture these because you've probably all seen the commercials on television for these incredibly expensive drugs. You'll notice that one of them on here, Fiasp, is in red. I'll explain why that's in red here in just a second. So these are the drugs for which CMS has already negotiated a price that should bring these prices down significantly. And from what I've been able to see, they have. Now, the reason why the Fiasp was in red is this. We're going to talk about one of the other changes for this year, and that is the insulin costs cap. So we've already known that the insulin costs were capped at $35. That started a couple of years ago, where insulin could not be more than $35 per insulin per month. Starting this year, starting 2026, the insulin cost will be capped at the lesser of $35 or 25% of the maximum fair price established for the covered insulin product under the Medicare Drug Price Negotiation Program. So Fiasp or Novolog, that's one of the drugs that was negotiated by CMS. So if 25% of that price is less than $35, then that's what the person would pay. Or it could be 25% of the negotiated price of the covered insulin product under the standalone Medicare prescription drug plan. In other words, if their specific Part D plan has a better price, or if they're on an MAPD, a Medicare Advantage plan that covers prescription drugs, then that 25% would be what they would pay. So it's whatever the lowest cost is for that insulin. Now, the good news is the beneficiary doesn't have to do all this calculating. When they go to the pharmacy to pick up their insulin, this information will already be calculated within the system for them. The other change that we know of for 2026, we already know that there were some vaccines that were going to be offered at zero cost sharing for adults, things like the shingles vaccine and things like that. Beginning effective 2026, all adult vaccines recommended by the Advisory Committee on Immune Practices must be covered by Part D plans at no deductible or cost sharing. So that's now all adult vaccines that are recommended by this board. So things like shingles, COVID-19, anything like that. So this is a conversation that beneficiaries are going to want to have with their doctor to say, hey, are there any vaccines that I am eligible for that you think I need to get? So, those can be covered by Part D. Now, some vaccines we know already are covered by Part B and have been for a long time now. The flu shot, things like that. You still get them the same way you always have. But for those shots that are eligible to be covered by Part D as in dog, you want to have that conversation with your doctor so you can make sure that you are up to date on all your vaccines if you want to get those done. Telehealth services. Boy, this has been a roller coaster ride. This is one of the services that during the time that the government shutdown was occurring, this had kind of uh, waned. It had kind of flagged because there had been no update on whether or not these had been extended. Telehealth services was something that during prior to the pandemic, you could only get telehealth services if you lived in the very rural parts of our state and you had to go to a healthcare clinic or someplace like that to actually take advantage of telehealth services. Then during the pandemic, you could go to pretty much any doctor's office, or not even that. You could get telehealth services from home during the pandemic. I mean, everybody was doing it. It was pretty much the only way you could get seen by a doctor. Those extended services had to be reapproved by Congress on a regular basis. And because of the government shutdown, that approval did not take place. And so a lot of people who were taking advantage of that were told, stop. Well, now I can tell you that the expanded telehealth services have been extended through January 31st of 2026. There's no geographic restrictions. They can be provided by any eligible Medicare provider. However, beginning February 1st, unless there's another action to extend it, the policy will revert back to the pre-pandemic rules. There is a website, telehealth.hhs.gov, that you can watch to monitor what's the status of telehealth services. Some people would like to see them changed and allowed more frequently for different people for different reasons. Now, they did make some adjustments. They actually extended the use of telehealth services for certain behavioral health reasons and things like that. But by and large, telehealth services, as it's written right now, are still only meant for very rural areas and to be offered from health clinics for the purposes of just the transportation issues. And so we'll wait and see if anything's going to get changed permanently related to that. But for right now, it's the way it was during the pandemic. Somebody, if they needed to, could have a telehealth visit and it would be covered by Medicare. Now, the Medicare Supplement Birthday Rule. This has been around since 2023, but I still get a lot of phone calls. This morning, woke up this morning and I had a message from somebody about this. For people who currently have a Medicare supplement policy, this new birthday rule, if you're on a Medicare supplement and you want to shop around and see if maybe there's a Medicare supplement out there that could save you some money, during the 60-day period that starts on your birth date, you can shop around and possibly purchase a Medicare supplement that has the same or lesser benefits during that 60-day period. They can't deny you. They can't do any kind of medical underwriting or pre-existing condition clauses or anything like that. All right. It's just like a new open enrollment period. Okay. So this is fairly new. Like I said, it was the end of 2023 when this got put into place. So if you're interested in taking advantage of the birthday rule, you can reach out to us. You can call us at 1-800-763-2828. You can also email us at map@oid.ok.gov and say you'd like to get a comparison. Tell us which of the 10 standardized plans you're interested in. We also would need your zip code. We would need your age and your gender and whether or not you use tobacco products. And we can send you a comparison of the plans of whatever of the plans that you're interested in. And you can shop around and possibly get a better deal for a Medicare supplement plan. This is not in every state, folks. This is the rule that's here in Oklahoma. Now, some other states have established a birthday rule, but the birthday rule in each state is going to be a little bit different. This is Oklahoma's birthday rule. Now, the last thing that I wanted to touch base with you folks on, it may not be the last. I think I actually added something else, but this is the WISER model, the Wasteful and Inappropriate Services Reduction model. This kind of came as a surprise to most people here in Oklahoma. I know that it did to me, as well as people in about 5 other states. Um, it's the first time that traditional Medicare has been in a situation where we've required prior authorization. This came down from CMS, and they're going to be utilizing artificial intelligence to do prior authorizations for specific services and items that are covered by traditional Medicare. What will happen is if a Medicare beneficiary needs one of these specific items or services, the provider will have to submit a request into CMS for their patient to get this service, pretty much exactly like they would have to if that patient was on a Medicare Advantage plan. This request will be put through this AI system, this artificial intelligence system. If it meets the requirements for this artificial intelligence system to approve it, then it will be approved. If it is denied by the AI system, then it will be kicked out to be sent to a person, to a human being to be reviewed by them as well to see if maybe the AI system made a mistake or something, but it could still be denied. So here's some examples of the items that are on the list of things that are impacted by this wasteful and inappropriate spending model. Skin and tissue substitutes, implantation of electrical nerve stimulators, and knee arthroscopy for knee osteoarthritis. So this is a change. This is a big shift. It's caught the attention of a lot of people. I know that AARP has come out very strongly against this because, again, this is definitely something that has been seen as much more Medicare Advantage like than traditional Medicare. With traditional Medicare, it's typically left up to the physician, and if the physician feels like it's medically necessary, then it's covered. So you need to be aware of this in case your physician is needing to, uh, if he says you need something done, but he's going to have to send some kind of approval, this could be why. So if you hear about, the WISER model, that could be something that's in your future. Now, watch for any unexpected changes, folks. This is something that we tell you, and I need to re-emphasize this because it's getting worse and worse. Always, always, always read your mail. Yes, I know it looks boring. I know that it all looks like chain mail and junk and things like that. Look for anything that might indicate a change in your coverage. Review your Medicare summary notices. Look at any EOBs or other mail. If anything seems like it's something's gotten changed or shifted or something like that, you want to report that because if it's possible that somebody might have gotten you switched to a different insurance, that could create problems when your doctor is trying to submit claims for you. So we want you to report that as soon as possible, just to make sure, maybe it's not, maybe your insurance hasn't been changed, but you want to make certain, okay? Make sure that your insurance information is current. All right. If you did change your policy, maybe you switched to a different Medicare Advantage plan this year, or maybe you changed your Part D plan or something like that. If you did, let people know. Let your doctor's office know. If they don't know that your insurance changed, the first thing they're going to do whenever they file a claim next year, it might go to the wrong insurance company, and that slows things down. So make the right people aware of the fact that your insurance has changed, and also your family members. If you made a change in your insurance and there's somebody that kind of helps look out for you and you've got a caregiver or something like that, make them aware as well. keep your information accurate. You know, you want to make sure that all the information that you've got listed as far as what's your insurance, do you have retiree coverage, any military coverage, who are your current doctors, what's your current medications, what health conditions do you have? You got to keep that information handy and keep it accurate. You know, if something were to happen and you were unconscious at home and emergency personnel were to show up on site, they're going to need that information. One place that you can keep that is in a healthcare journal. We've got these available at the Oklahoma Insurance Department. You can send us a message, you can call us, and we'd be happy to send these out to you. They're free of charge. Just let us know. Now, this is our phone number. You can also, great resource here in Oklahoma is insurance agents. We have got great licensed insurance agents in the state that are there to help you at all times. This is what they do, folks. I strongly encourage you, if you are looking to purchase an insurance product, you are going to be in a much better position if you talk to somebody face to face here in Oklahoma, as opposed to calling some 800 number that you saw on the television or on the internet. You call that 800 number, you don't know from one time to the next who you're going to be speaking to the next time. So take advantage of our local agents if you can. Medicare.gov is a great website, folks, and it's got lots of information, lots of great resources. Medicare.gov, not Medicare.com or Medicare.org. Those are two completely different resources, so don't be fooled. Go to Medicare.gov if you've got any questions. Now, these are the agencies that we contract with around the state. If you've got any additional questions, or if you'd like to sit down and talk to somebody face to face, as opposed to getting on the phone and talking with one of our counselors, you're certainly welcome to do that. But these agencies are contracted with us. They've got counselors that have been through our training program, and they're happy to help you wherever you live. So now, Rachel, do we have any questions?
Yes, we do have several questions. So I'm just going to start with the first one. When the Part A ends on the 62nd day, does the regular yearly deductible still apply? Does it start again brand new?
Oh, great question. Yes, you have to pay the deductible again each new benefit period. So when your new benefit period starts, the first thing you're going to pay is the deductible, and that all starts over again.
Perfect. The next question is regarding the skin subs. Is authorization required for places of service 31 and 32 or only for 31?
That's a question that you're going to have to ask a clinician. That's way beyond our pay grade.
Perfect. Okay, do we know if providers will need to submit authorization requests directly through the CMS portal? If so, do we have any indication of when CMS will release those details?
That's for the wiser. We're talking on the consumer side of things. The providers are going to have to talk to the provider folks, the CMS folks, as far as how they're going to have to do their authorizations, what things are going to be impacted, the coding, all of that stuff's going to have to come from CMS.
And then the last one I think is also kind of provider related, but if a provider participates in Medicare, are they required to participate in all the Advantage plans?
No, absolutely not. That's a business decision that the provider themselves makes. A provider can participate in Medicare. They can contract with one plan, but not the other plan. That's entirely up to the provider.
Perfect. Those are all the questions. I did just want to mention, I know we had a couple users with some technical difficulties having some issues seeing the screen. And so I do want to just mention that if you were unable to see everything today, you can always watch our Medicare Monday videos on demand on our website. And so if you go to map.oid.ok.gov, We've got an educational videos tab there on the left-hand side, and we put all of our Medicare Monday recordings there. Usually they're up within 24 hours of the webinar. So if you weren't able to see everything today, that's a great place for you to go and view that information at a later time.
Okay. All right. I really appreciate you guys being with us today. And I thank you guys for joining us at other times. We are going to do these again next year. Rachel and I were just talking about getting together. If you guys have any suggestions of topics that you would like to see, please do send me an email, ray.walker@oid.ok.gov. I always would love to hear your suggestions of any topics that you would like to hear about. That would be very beneficial to us because that also helps us to know what are the areas that maybe we're not covering that we should be. So, hope you guys have a great week. Hope you have a wonderful Christmas, and we look forward to talking to you next year. Thanks.